and everyone present here. It's a beautiful day here in Kashmir. How are not to gather under one roof and learn and recognize the issues heating up the medical world?
Two things that are distinct yet deeply connected. Atop of every household, diabetes and obesity. Diabetes, a metabolic traffic jam, too much glucose and too little control. And obesity, extra weight with extra consequences.
The Postgraduate Department of Medicine, GMC ANANTNAG, is thus conducting a one-day CME to help us recall, know, and learn the topic more, so that we can implement it in our day-to-day lives and practices. So buckle up your seatbelts as me, Humans, and my friend Ariba will help you navigate through the day.
Nothing, no symptoms of diabetes. So they can still have diabetes. So very important. And you can see the very important from Lancet, the global burden of diabetes. That is, it can rose from 529 million to 1.3 billion by 2050. And every country is going to expect its rise every year. Providing the first accurate description of diabetes, coining the term diabetes. And followed by 17th century Thomas Willis, he added the term mellitus to diabetes, that means the sweet taste of the urine, and the 19th century Claude Bernard and the discovery of the glycogenic action of the liver, and Oscar Minovsky and
we'll have a spike in the face every morning, no insulins, no drugs. Thank you, Department of Medicine, for arranging such a wonderful function.
Hereby, as a daily ritual, he dips in the feet and waits the nerves to soothe them and tries to sleep again. But this burning continues. He says that my feet look normal, my tests are also normal, but the fire inside no one else can see. He only feels it. So he is not alone. Millions around the globe experience this silent, invisible fire.
So there is a suggestion we should cover the sing on a small sort of song when you sit, but it's too fast than that. So it's a dancing like a movement. I tried to catch her face. Small movement occurs on the right side of the face also. So she has started 5 days back this movement. So when I took the history, patient, as I mentioned, he has a tingling and numbness from the last 6 months. She typically gave me the history that she has started tingling numbness during night, particularly around the hands, below the wrist and below the knees up to the ankles. She has these with utensils or with groceries from the market. She has to sit while walking, take a rest of 1-2 minutes, and then she can go on started. Finally, she has started these involuntary movements on the right side of her body. When I took the general physical examination, when I examined her,
our patron today, Professor Ruxana Najib, our principal, our co-patron, Professor Rafi Ahmad Jan, ex-HOD Sikkims and Medicine Sikkims Sogra, our co-patron, Professor Muhammad Ashraf Bhatt, ex-HOD Nephrology Department Sikkims, Dr. Arshid Hussain Siddiqui, our medical superintendent, Mr. Muhammad Oyub Lone, our chief accounts officer, Mr. Peer Khurshid Ahmad, our ADP. I welcome you all on this inaugural ceremony of our CME on diabetes and obesity. Regarding the obesity, which we all know that since for the last 20 years that gloom of diabetes has affected almost now everybody in our city. Previously supposed to be disease of affluent people. Now this burden has gone to again to our developing nations. Our India is now considered to be the diabetic capital of India.
the main component is because of the ischemia, because they are having increased atherosclerotic diseases.
Problem and affects all systems of our body. We have given different lectures by our speakers that talk the burden of the disease by the Dr. Abid Saab, who is an endocrinologist with us. he got the burden of the disease, how it has evolved over the period of time, and different lectures by different people that how it affects the different systems, neurology, nephrology, cardiology, even liver also. She will start the MD courses in GMC ANANTNAG. And she gave us that to just to see what are the deficiencies. When our first meeting was there, I was 100% negative that we have nothing. How can we start this program? But it is the quality of a leader that she took that initiative and told that our dream that I will start with MD here. We put a happy amount to start that. I was really nervous that maybe if we lapse that amount, maybe we will scrutinize later on that. This shows the quality of a good leader, a vision of a leader, that how she handled that situation, and we have got MD in. It's not a joke that MD starting in a peripheral hospital. It's not a joke. It is a tremendous courage, and now by the grace of Allah and by her high commitment, that we have started MD courses in our 5 branches. That's ANP, pediatrics, anesthesiology, surgery, and medicine. That shows the commitment. That shows the hard work of a leader. If a leader is good, that is how our college has progressed. It has bypassed all the peripheral medical colleges of this valley. It is because of the good leader qualities.
Madam, it's my honor to be here to welcome you on an inaugural function of CME on diabetes and obesity. As we all know, diabetes is a complicated disease because it will affect all the organs of the body. And why do we take these seminars and CMEs and we celebrate World Diabetes Day? Is to make people aware of a disease which can be prevented and where we can prevent the complications. Like we have diabetes type 1, type 2 and gestational diabetes, where in diabetes type 1 we could have prevention, and in gestational diabetes, although it will be there, but it will go after some time. But the treatment is very important. I being in anesthesia department, I have seen how diabetes affects all the organs of the body, and how we during surgery say, oh, this is a high risk case, it is ASA3 because of diabetes. He has diabetic nephropathy, diabetic uropathy, he has neuropathy, and he has heart disease. Doing an excellent job. It is not that the department is not working hard. They have done 100 cases of ERCP, and most of the cases are done under anesthesia. Yes. So this means they are doing remote anesthesia. So I will congratulate both the departments for doing an excellent job, because it is really a dream come true for doing such cases in a peripheral medical college, where you have to anesthetize a patient in an ERCP lab. That is why we are forced to give them a well-equipped lab. So you will be shifting to the new lab now. Yes, so we announce them a new lab. From today onwards, they will shift to that place.
Blood sugar control or HbA1c reduction. So, what are the mechanisms actually, other than the HbA1c reduction, are the fast these blood sugars which actually affect the cardiovascular mortality? So, when we come to the heart failure, we have two subsets of the patients, broadly speaking. Heart failure with the reduced ejection fraction, and of course heart failure with the preserved ejection fraction. 50% of the patients who come to us in the clinics, their echoes are normal. The ejection fractions are more than 50%, but they come with the symptoms of dyspnea, they have the nocturnal dyspnea, they have pedal edema, and their functional capacity is reduced. When you do their NT-proBNP, which is actually a marker for the heart failure, it's elevated. So, the pathophysiology in these patients is varying. So, there is volume expansion from the obesity, because these patients are usually obese. There is a concentric LV remodeling. The filling pressures in the left ventricle, they are very high.
Semaglutide. Was it a clinical trial or it was just an observational study?
It is basically a randomized observational study, as I said.
Somehow abated, but if it continues unabated, there will be continuous rise in glomerular filtration rate, and eventually it will reach a baseline of 110 again. But at what cost? At the cost of 50% nephron mass loss. At this point of time, person again have GFR of 110, but he will have lost 50% of his nephron mass, and he will be having increased albuminuria. That is why albuminuria is so important in nephrology, especially in glomerular diseases in general and diabetic kidney disease in particular. And there are some other pathogenic factors like increase in tissue growth factors as well as increase in lipid factors, which leads ultimately to diabetic complications of microvascular as well as macrovascular. That not only modify major adverse kidney events, but they also modify major
functional and metabolically active like adipose tissue. So it is not hyperglycemia, it is adiposopathy. When we take excessive calories, they get deposited in the liver. Your adipose tissue, lean adipose tissue, your pancreas, muscles and intestines. So what happens when there is a fat deposition in NFL, it is an inflammatory disease. There is a shift of the markers, anti-inflammatory markers from M2 macrophage to the M1 macrophage. You can see in the slides. In the lean liver, these white cells are Kupffer cells. They constitute around 10% of the lean mass of the liver. And they have anti-inflammatory cells. You can see in remission.
That is also with metabolic surgery, but there are studies of patient is regaining weight after metabolic surgeries also, and finally immunity drugs also, even after surgery. There are studies.
If that fat goes more than 5-10%, we call it fatty liver disease. Fatty liver. So this terminology of fatty liver over a period of time has changed. We used to call it NFLD, then what is called a NASH. Now it has changed the terminology from what we call as alcohol. It is now more of a metabolic dysfunction associated liver steatotic liver disease. So how should we say that somebody has this problem? Either somebody has gone a biopsy, which is not done presently. Commonly, what we do is an ultrasonography, which is being done routinely for many costs, many things. So we got on ultrasound, we found a liver which is slightly bright in echo pattern, and we call it fatty liver. Depending upon the grades, that they red or blue. Some drug that they do that thing. Against the evidence part.
We are running short of time. Only don't forget. Have you seen from last 4-5 years any USG without grade or fatty liver? Honestly, what is that? What is that? Is it abnormality or is it normal?
No, I will tell you. Somebody told you somebody's masala and NASH. They have peptides. If enzyme reaction is there and you have access to other causes, these are the people who get cirrhosis.
What is the experience? How many people have seen over the last couple of years cirrhosis as a result of?
I am telling you that is what is the importance of them. I told you that we have a lot of diabetics. They have been treated for the last 10 years. They don't take ultrasound.
Chances of hypoglycemia with metformin are least. So what are the pharmacokinetics? It is absorbed orally, not metabolized in the liver, it is excreted unchanged in the kidneys, and it freely crosses the placenta. So what are the ACOG 2023 recommendations for the treatment of GDM? ACOG considers insulin as the first-line pharmacological therapy for GDM. Metformin is only considered if a patient declines insulin or cannot use it. But the use of metformin, before starting metformin, the patient is to be counseled regarding the placental transfer of this drug.
So actually this was all about the innocence of the childhood. When a child is diagnosed with diabetes, it means that he is going to lose this childhood. He is going to lose the innocence of the childhood. This is the first bad thing that happens to a child. When every baby is playing, when every baby is taking part in parties and he is not able to do the same thing with other babies. He feels that now he is sick, he's not well, he cannot take
Not is colonial. We don't do anything else. So we don't have a much confusion. They get rid of any useless food and they walk from their processes and they live a good life.
Thank you.
Our administration, madam, for giving this call. I congratulate Dr. Mashkur, the director of the